What if the very medications meant to heal you were silently harming your mind? Today, we're pulling back the curtain on a startling reality. Some of the most commonly prescribed drugs, ones sitting in your medicine cabinet right now, could be linked to memory loss, brain fog, and even long-term cognitive decline. This isn't fear-mongering. This is science. And by the end of this video, you'll know exactly which medications to watch out for, how they might affect your brain, and what you can do about it. Let's start with a hard truth. Modern medicine saves lives, but no drug is without risk. While medications treat ailments, they often come with side effects, some mild, others severe. But when those side effects involve your brain's ability to think, remember, or stay sharp, the stakes feel terrifyingly personal. Cognitive decline isn't just about forgetting keys or names. It's about losing pieces of who you are. And for millions, the culprit might be hiding in plain sight, their daily prescriptions. Before we dive in, a critical disclaimer. Do not stop taking any medication without consulting your doctor. This video is about awareness, not alarm. Knowledge empowers you to ask the right questions, work with your healthcare provider, and find safer alternatives if needed. Now, let's unravel the list. Anticholinergic drugs. First up, anticholinergic medications. These include drugs like diphenhydramine, the active ingredient in Benadryl and many over-the-counter sleep aids, certain antidepressants like amitriptyline, and even medications for bladder control like oxybutynin. Anticholinergics block acetylcholine, a neurotransmitter vital for memory and learning. Studies show that long-term use, especially in older adults, is associated with a 50% higher risk of dementia. The longer you take them, the higher the risk. Scarier still? Many people use these drugs for years without realizing the toll on their cognition. 2. Benzodiazepines. Next, benzodiazepines. Drugs like Xanax, Valium, and Ativan. Prescribed for anxiety, insomnia, or panic disorders, these sedatives are meant for short-term use. Yet millions rely on them for months or even years. Benzos dampen activity in brain regions involved in memory formation, and research links prolonged use to a 60% increased risk of Alzheimer's. They're a lifeline for some, but dependency and cognitive fog often follow. If you've been on them long-term, it's time to talk to your doctor about tapering strategies. Proton pump inhibitors, PPIs. Number 3 might surprise you. Acid reflux medications like Nexium, Prilosec, or Prevacid. Proton pump inhibitors, PPIs, are wildly popular, but studies suggest they could interfere with vitamin B12 absorption, a nutrient critical for nerve health. Low B12 levels are tied to memory loss and confusion. Even more alarming, a 2016 study found PPI users had a 44% higher risk of dementia. While occasional use is likely safe, chronic reliance could come at a cost. 4. Statins, the cholesterol-lowering giants like Lipitor and Crestor, land at number 4. While they prevent heart attacks, their relationship with the brain is complicated. Some research suggests statins might protect cognition by improving blood flow, but other studies show high doses can impair memory and focus, possibly by depleting coenzyme Q10, a compound essential for brain energy. The verdict? Mixed. If you're on statins and noticing mental fog, don't dismiss it, bring it up. Corticosteroids. At number 5, corticosteroids like prednisone. Used for inflammation, asthma, or autoimmune diseases, these drugs are potent but perilous. Long-term use can shrink the hippocampus, the brain's memory hub. One study found patients on high-dose steroids for 6 months or more had significant cognitive decline. The good news? Lower doses or shorter courses may reduce this risk. Always weigh the benefits against the brain's fragility. 6. Antihistamines, first generation. Back to the medicine cabinet. First-gen antihistamines like chlorpheniramine or promethazine. Unlike newer allergy meds, like Claritin, these older drugs cross the blood-brain barrier, causing drowsiness and chaos. By blocking acetylcholine, they mimic anticholinergics, scrambling short-term memory and focus. Frequent use, especially in older adults, is a red flag. Swap them for non-drowsy alternatives if possible. Opioids. Number 7. Opioids. Painkillers like oxycodone or hydrocodone aren't just addictive. They're cognitive saboteurs. Opioid receptors in the brain regulate pain and cognition. Chronic use dulls mental sharpness, slows reaction times, and impairs decision-making. Even short-term, they can cloud thinking. With the opioid crisis still raging, this is a double-edged sword. Pain relief versus preserving your mind. 8. Antidepressants, tricyclics, and SSRIs. Antidepressants make our list at number 8, but not all of them. Older tricyclics like doxepin have strong anticholinergic effects, while even some SSRIs, like paroxetine, can mildly block acetylcholine. Depression itself harms cognition, so this isn't black and white. But if your medication leaves you feeling mentally flat, explore alternatives with your psychiatrist. Mental health matters, but so does mental clarity. Sleep aids, non-benzodiazepine Z-drugs. Number 9. Z-drugs like Ambien or Lunesta. Marketed as safer than benzos, they still hijack brain receptors involved in memory. Users often report blackout episodes, sleepwalking, binge eating, or driving with no recollection. Long-term, studies tie them to a 30% higher dementia risk. Insomnia is hell, but dependency on these pills might trade one problem for another. 10. Beta blockers. Finally, beta blockers like propranolol for high blood pressure or anxiety. By slowing heart rate, they can also reduce blood flow to the brain. Some patients report depression and memory issues, though research is conflicting. If you're on beta blockers and struggling mentally, ask about alternatives like ACE inhibitors. Your brain's blood supply is non-negotiable. So what now? First, don't panic. Many of these drugs are necessary, even life-saving. But if you're on one long-term, especially anticholinergics, benzos, or PPIs, have a frank talk with your doctor. Ask, is this dose still necessary? Are there safer alternatives? Could we trial a break? For over-the-counter meds like sleep aids or antihistamines, rethink autopilot use. Your brain isn't replaceable. Stay vigilant for symptoms: forgetfulness, confusion, trouble concentrating, or feeling foggy. Track when these started relative to your medications. An advocate for yourself. Doctors aren't mind readers. Bring research, ask questions, and collaborate on a plan. Remember, aging doesn't have to mean cognitive decline. Some risk factors are within your control. Prioritize sleep, exercise, a brain-healthy diet, and stay mentally active. And share this video. Awareness is power. Millions are unaware their meds could be harming their minds, and you might help someone reclaim their clarity. Thanks for watching. If you found this eye-opening, hit subscribe and the bell. Your brain is your greatest asset. Let's protect it together.